You walk into a clinic actively experiencing a neurological event, maybe a focal seizure or severe anxiety. You can barely process your surroundings, let alone write. The receptionist hands you a clipboard with a 15-page intake packet. The American healthcare system has spent billions of dollars optimizing back-end hospital servers and billing portals. Yet the literal first mile of your care relies entirely on you acting as a manual data entry clerk, exactly when you are sickest. You are asked to sit in a crowded waiting room and recall decades of surgical history, hereditary risk factors, and the exact spelling of 12 different medications from memory. For millions of Americans, this analog barrier is insurmountable. If you are a patient with selective mutism, post-stroke aphasia, or an active seizure disorder, you are often physically incapable of speaking to the front desk or filling out a form. The system does not remember your medical history. It requires you to remember for it. Administrative tasks in U.S. ambulatory care consume $8.3 billion annually, mostly wasted at the intake window. Worse, a single paper form spelling mistake contributes to 1.5 million preventable adverse medication events every year. Hospitals invest massive sums into electronic health records, the databases like Epic and Cerner that doctors use. Those systems are incredibly powerful, but they sit entirely behind the reception desk. They do absolutely nothing to help you before your appointment begins. Existing patient portals are administrative terminals built to optimize billing workflows for institutions. They lack the architecture to serve a patient in active distress. Aura OS acts as the control layer between your biology and institutional healthcare, providing a sovereign operating system for your medical history. The architecture is built on a local-first SQLite database. Your health data lives strictly offline on the device you already own, secured by mathematically rigorous AES 256 encryption. The decryption key is tied directly to your phone's biometric sensors. If you opt to back up your data, the cloud server receives only unbreakable ciphertext. Aura holds 0 decryption keys. Even in the event of a total server breach, the data remains completely unreadable noise. Legacy portals lock your readable records on centralized servers and demand a constant internet connection. Aura operates flawlessly even if you are entirely offline, guaranteeing your data is accessible in a dead zone or during an active emergency. Because the company never possesses the keys to read your data, it legally operates as a personal health record under the FTC health breach notification rule. This completely eliminates the need for expensive HIPAA business associate agreements that heavily tax standard health tech startups. By removing data custody from the hospital, the patient stops being a passive subject and becomes the cryptographically sovereign owner of their own medical identity. But this creates a serious interoperability hurdle. How do you securely push this sovereign data into a hospital's legacy system without requiring a massive multi-year IT integration contract? The solution is the Bi-Directional Clinic Handshake. When a patient approaches the front desk, they use their phone to generate a secure, temporary QR code. The receptionist simply scans that code using a standard clinic iPad. There is no software to install. The iPad's native browser immediately opens a secure decryption sandbox. Here is the architectural breakthrough. The decryption key is passed locally via a URL hash fragment. Browsers are hard-coded to never send hash fragments to external servers. The key bypasses the cloud entirely and routes directly into the iPad's local memory. The payload decrypts instantly inside the browser. The physician receives a cleanly structured file formatted to national healthcare data standards, detailing your allergies, vitals, and exact medication history. This mathematical end-to-end encryption eliminates millions of dollars in corporate compliance overhead while giving the patient a zero-friction, error-free intake experience. Still, what happens if the clinic is entirely air-gapped, running 20-year-old software, and has zero capability to scan a digital payload? The platform includes a fallback. You can instantly generate a rigidly structured black-and-white PDF directly from your offline vault, printing a complete clinical summary. A front desk worker can take that document and run it through a scanner, piping human-readable context straight into their system's media tab. Between the digital handshake and the printed fallback, Aura guarantees a patient can securely transmit their history to any clinic in the world on day one without waiting for a single IT department ticket. A grueling 20-minute ordeal with a pen and a clipboard is compressed into a pristine 60-second digital handshake. Because the physician receives your chronological, structured health data before they even open the exam room door, they spend fewer minutes transcribing notes and more minutes actually treating you. For 50 years, the medical industry built software strictly to optimize the hospital's data systems. Aura is the first platform built exclusively to optimize the patients. It is time to abandon the clipboard penalty. By flipping the terminal and securing the first mile of healthcare, we can finally scale the human operating system.